next is about anticholinergic drugs. These anticholinergic drugs, there are three types. We have antimuscarinic, which acts on the M1, M2, M3, M4, M5, and they may have the ganglionic receptors in blockers, and we have the neuromuscular blockers. Now first let's show you about the muscarinic drugs. Antimuscarinic drugs are atropine, hyoscine, scopolamine, ipratropium, tiotropium, and we also have, these are all non-selective drugs. The selective drugs for M1 blockers are, that is pyranzapine and tilenzapine are M1 selective blockers. M3 are sulfinacin, darifenacin, oxybutynin, flavoxate, these are all these things. And also we have glycopyrrolate. All these drugs belong to muscarinic antagonists. Now about each drug. Before all this, what does antimuscarinic do? Antimuscarinic will increase heart rate, and then it will cause bronchodilation, so it's useful in COPD and asthma. And on GIT, it will relax the intestine, so it's useful in scopolamine, hyoscine, all these, they'll relax the intestine, so they'll prevent even vomiting. Scopolamine patch is also given to prevent vomiting. It's an antispasmodic. Hyoscine, buscopan. Buscopan is what is used in kidney stones. Hyoscine, buscopan, clinidium, all these things are there. And M3 blockers are urinary bladder incontinence can be reduced. And glance is to decrease the secretion, dry eye, mouth, skin, larynx. And pre-anesthetic medication is what we use as glycopyrrolate and quaternary ammonium compounds. Glycopyrrolate is a quaternary ammonium compound. And also, what does it do? It causes mydriasis. And also cycloplegia. Causes mydriasis and cycloplegia. Only phenylephrine will cause mydriasis with no cycloplegia. We'll talk about that in further things. Okay, and then phenylephrine is an alpha-1 agonist, so it's not an antimuscarinic. Antimuscarinic drugs will cause cycloplegia. Okay, so about eye, we'll talk about it later. So this is what happens in muscarinic drugs. And as far as ganglionic blockers are concerned, as well as ganglionic blockers are concerned, we have nicotine, which is actually we'll talk about nicotine later. And then neuromuscular blockers, we have drugs like I'll show you the classification. 1 second, it's better if I show the classification. Okay, so muscarinic antagonists is what atropine, scopolamine, tropicamide, ipratropium, darnifenacin. M3 is darnifenacin, pyranzapine, M1, glycopyrrolate, anesthetics and all. And nicotinic antagonists, so these are ganglionic blockers. We have NN antagonists, which is trimethophan, hexamethonium and mecalamine. NM antagonists, we have depolarizing and non-depolarizing. Depolarizing is what hexamethonium, dexamethonium. Non-depolarizing is pan, vecu, roku, D-tubercular, mivacurium, atracurium. So all these drugs will produce antimuscarinic actions. So that is what is important. Now, atropine. So if you see what atropine does, atropine at high dose will cause mydriasis. And as I told you, antimuscarinic drugs, anticholinergic drugs should not be given in case of glaucoma. So it should not be given for glaucoma, so you should take care of that. And but it is useful since it causes mydriasis, it can be useful in refractive testing. And OPC poisoning, we talked about OPC poisoning. Now atropine poisoning, the effects will be dry as a bone, so all the secretions will be dry, so that will cause hyperthermia, and flushing will be there, and since heart rate also will be increased, and mydriasis and cycloplegia will be there, and CNS can also be affected, causing delirium. So drug of choice is physostigmine. Even physostigmine is drug of choice for Atropa belladonna poisoning and Datura poisoning. Atropa is what Atropine it produces, and Datura also physostigmine is used. Okay. When do we not use Atropine? First, since Atropine is a anticholinergic agent, antimuscuranic agent, it's not used in glaucoma. At the same time, it's not used in urinary retention because Atropine can also cause a relaxation. Anticholinergic will cause a relaxation of the bladder, so it can worsen the urinary retention, and tachycardia, again it can worsen the tachycardia and arrhythmia. So that is what is important to remember. And then scopolamine. About next drug, we have hyoscine and scopolamine. Antispasmodic, motion sickness, it can be used. If we talk about the next drug, ipratropium and tiotropium. See, ipratropium, it's a non-selective drug, but will act only on M1 and M2. Tiotropium will act on M1 and M3. So tiotropium is the longest acting drug, and also it's used where are these used? Ipratropium, tiotropium, they are used in asthma, COPD, etc. Okay, so that is about ipratropium and tiotropium. Okay, and also one more thing you have to remember is tiotropium. How do they cause? Why are they useful in asthma and COPD? Because they'll inhibit the mucociliary clearance, which is by atropine, which will result in lower of airway secretions and mucous hair plugs. However, the inhibition of the mucociliary clearance is more in atropine than compared to that of ipratropium and tiotropium. So that is important. Okay, and then we have oxybutynin, which is all useful in oxybutynin is all useful in case of overactive bladder, that is with the detrusor hyperactivity. Now, what is the function of these M3 blockers? So solifinanin, darifinanin, how do they act by producing muscle relaxation? Is what they'll do is they will see all these antagonists, they will relax the bladder with the help of lowering the intravesicular pressure, increasing the bladder capacity, and lowering the frequency of the bladder contractions, and alters the bladder sensation during filling. So that is how they are useful in detrusor hyperactivity. So what are the other M3 blockers are? We have fluoxetine, oxybutynin. Bladder selective is toluridone, fesoritodone. Quaternary compound is trospium. M3 selective is what? Solifenacin and darifenacin. Okay, and then so this is M3 blocker. Then selective M1 blockers. See, one more thing, in atropine we don't give it for patients with peptic ulcer disease. Now, why pyrazipine is only used in peptic ulcer disease? Because M3 receptors are not present in the stomach. They are not present in stomach. Only M1 cells are present in stomach. So selective M1, pyrazipine and tilazepine is used. Atropine will worsen because atropine will initially have a preganglionic inhibition of atropine has inhibition of M1, M2, M3. All these things are being reduced in case of atropine. So I think 1 second I will just show.